Today's guest is Lester J. Morales, founder and CEO of Next Impact. Lester is a career-long innovator and disruptor in the human capital and employee benefits arena. Lester founded Next Impact to support the education and expansion of transparent health benefits, a set of innovative, cost-containment health benefit strategies. Prior to entrepreneurship, Lester served as Chief Growth Officer for Willis Human Capital Practice, one of the largest insurance brokerages in the world. Lester, thanks for joining me today.
Awesome. I'm super pumped to be here.
Oh man, this is great. I met Lester through a friend, Paul Steele, who came on the podcast a couple of weeks ago, and in doing some background research on Lester, I love this whole idea of doing what you do in your daily life with a specific purpose. And Lester lives that out in a very specific way. And so, Lester, maybe just start out the episode. I typically start with background. How did you get where you are? And it's generally more career driven and whatnot. But you have an amazing why of why you do what you do and how you got here. So let's start out there and just give the listeners a little bit of feedback.
Yeah, it's always funny, right? The strong why comes from a crappy reasoning, but so when I was 15 years old, my dad was diagnosed with multiple myeloma. So that's cancer of your bone marrow. Bone marrow transplant, chemo, radiation. And the weird thing is, both of my parents had jobs. They both had health insurance. But when you look at a normal health insurance program, and the reality of it is a family out of pocket max, right, is $8, $10, $12, $15,000 a year. Well, my dad was on a drug called Revlimid. Revlimid's $150,000 a year, and it will be a medication that somebody post bone marrow transplant will be on for the rest of their living lives. So, year over year over year, well, how many families have that kind of leftover, dough when you're trying to send your kids to baseball camp and put Air Jordans on their feet, right? And so when I was a junior in high school, my parents had to file bankruptcy. And I'll tell you, man, I didn't really know at that moment what that meant, right? We didn't lose the house. I never was on the side of the street, nor did I kind of know how it was going to play into my career. So, fast forward, I go to Florida State University. I get my degree in risk management insurance because I had a tangible story and connection to insurance for the good and the bad. My parents were actually giving me $250 out of my dad's disability policy to go to college even. So I've been in health insurance my entire life. And unfortunately in 2012, my dad lost his battle with cancer, and in 2014, I'm a Puerto Rican boy, and so we're mama's boys, true and true. And so my mom in 2014 was diagnosed with pancreatic cancer. And, at that point, it was interesting because I had been in the business. I know this business inside and out. And you start to realize, if you Googled pancreatic cancer right now, you'd see that the life expectancy is less than 4 months. And so from that perspective, with dad, it was more financially based. Well, my brother and I, both do okay for a living and financially. And so when you look at that and you're like, 4 months, I want to send my mom to the moon if that's where she needs to go to get the best healthcare. But the reality of it is you're only getting told what's like right in your backyard, and knowing kind of how the whole system works. Well, if you're a doctor and you're owned by that hospital, where do you think all of your referrals are going to go to? And so it was really frustrating that we weren't getting told all of the things that I was just finding on my own on the internet and talking to other people. And so, my why, unfortunately, in 2017, my mom passed, and it was interesting. I had been in the business working for one of the largest consulting firms in the world. I was building health plans for a living for large employers, and I realized I was part of the issue. I was building health plans that required the same kind of $5, $6, $8, $10,000 out of pocket max that put my parents in financial ruin. And nowhere were the health plans that we were designing back then, and quite honestly, what most people are designing every day, are they putting the actual patient first? And so, the why is, man, once you start to realize that you can construct a health plan that helps people navigate the healthcare system, that when they are better healthcare consumers, and it doesn't matter if it's down the street or, I mean, I can't tell you how many people a week we're putting on an airplane because if they live in rural Kentucky, is that where you want them having a triple bypass? Or do you want them flying to John Hopkins because they have a better quality score? And so, the why is everything around. I don't want anybody to have to go through the things that we went through. And when you start to realize that the average person out there is filing bankruptcy, the average employer out there can't afford their health benefits. When you start to realize all this, you realize that the model, it's not broken. It's completely designed wrong. And so we built a business that takes the traditional health insurance model and flips it on its head. And unfortunately, we got to the route because of the experiences that we went through. But I got to tell you, every day we see stories that, saving this family 5,000, saving this employer 7 million. I mean, it's just unbelievable what you're able to do.
Yeah. First of all, my condolences for the hardships there. And I knew what was coming, obviously, from doing the background research a little bit. Um, but still, hearing it firsthand, face to face, it just hits a little differently. But also, kudos to you for turning it into a very powerful why, and I'm sure changing the lives of a lot of people by doing so. Um, but let's dive into it a little bit of like what that means, right? Building a healthcare plan. So I've had to implement in our business a healthcare plan over the last couple of years. It's a very painstaking process, can be incredibly confusing for someone who's not familiar with it. I think I was asked, a series of, call it 5 or 10 questions, handed a policy and said, good luck. And at the time, I was single or dating someone, but, no family responsibilities, so to speak. Now I'm married as of a couple of years or a couple of weeks ago, got a kid on the way. This stuff means more. And I've heard the horror stories that you're talking about, right? Like I've had family members pass away with terrible coverage and friends, had the same issues. So what does that look like in terms of building a healthcare insurance policy for these employers? How do you go about working with them? What does that look like?
Yeah, yeah. I think let's start with just kind of fundamental, and it's really interesting. I'm going to tell you a couple things, and you're going to be like, "Duh," but when you don't know kind of how to navigate it, and quite honestly, it took me 15 years of my career to kind of understand this. So, what does a health insurance company? What do they call your premium? So you pay premium every month. What does the health insurance company call that premium?
Income.
Revenue. Yeah. Who wakes up in the morning wanting to lower their revenue? So, like, fundamentally, the system is built on perverse incentives, misaligned incentives. You have the major health insurance companies, all of which, well, with the exception of Blue Cross, who's a non-for-profit, right? But all of which are publicly traded companies. They're fiscal responsibility is to their shareholders, not their clients per se. And then go down the ecosystem, go down that supply chain. A doc, a hospital, a pharmaceutical company. It doesn't matter. I need to fill beds. I get paid more money when I do more things. I am a pharmacist. I get paid to fill scripts. I'm a pharmacy benefit manager. I get paid more the more scripts I fill. Like everybody along the ecosystem. And then when you wake up one day and you're an insurance advisor and you're like, well, wait a second. Although I don't think anybody wakes up in the morning wanting to, stick it to somebody on purpose, but as my mom would say, if you want to know somebody's true intentions, follow the money, right? So if you look at a health insurance advisor, probably you work with one today, he or she probably makes more money when you pay more. So like fundamentally, like the first conversation we have with employers is the system isn't broken. It's completely designed wrong. And the reality of, changing how it works to align the incentives between everybody in the food chain. So first, you got to flip the model and take it away from where the insurance company is the decision maker for everything. And so, if you think about what insurance is, right? It's a network of doctors, right? It's, hey, is Dr. Jones in the network? Is that hospital in the network? Are my prescriptions covered? All of those things. Well, those are simple decisions that are made and very easy to do. Right now, the health insurance company makes those decisions on an employer's behalf. About half of Americans get their health insurance through their employer. So if I liken this very much to Vegas. You've been to Vegas. Have you ever came out of Vegas like, hey, I won, right? The house always wins.
Somehow it doesn't
It's
happen
the
to
way
me.
it's designed. It doesn't happen, like, right? There's some people that do. I'm not that lucky few either. So when you think about that, if they're deciding what the plan design is, they're deciding what drugs are on the formulary, they're deciding what doctors are in the network, they're deciding, why is that? Well, of course, that's why they win. And so when you think of like what has happened, and yeah, you're in the financial advising, game and in that spectrum, think about the increase of healthcare cost. Since 1960, health insurance has gone up every single year. Since the 90s, it has tripled in cost. So I'm going to draw on this piece of paper that I just happen to have sitting on my desk, right? There's a trend line, right? There's the, hey, it's cost is going up. I always ask employers to think about this. If I was your financial advisor and I turned that upside down and I said, I was losing you money every single year for the last 3 decades, would I still have a job? And it's really interesting when you think about an employer typically is working with one of the major insurance companies, all of which do not have a financial incentive to actually lower their cost. They're probably working with a health insurance broker, a lot of which both of those entities they've been working with for years and haven't really taken a step back to question that. And so when we work with employers and their advisors, it is taking a step back and saying, hey, fundamentally, the system isn't designed for you to win. How do we do that? Number one, we put the financial incentive in a structure that allows the employer to win. You budget $1. If you spend 75 cents, you keep a quarter in your bank account. That insurance is protected on a monthly basis from a cash flow, on a catastrophic basis for any one person that blows out the number, or on an annual basis so somebody can budget. So you're already there. But here's where the ticket lies. There is a healthcare advocate, a concierge tied to every single account. An employee who needs to access healthcare can pick up the phone and talk to this advocate. The advocate is looking at quality data and cost data. So we know there's public data out there that hospital has a 28 quality score and that hospital has a 98 quality score. Or the joke, right? The last place person that walks across the stage at med school is still called doctor. The reality of it is all of those folks have quality metrics, and you also understand what the cost basis is. So if I understand that the quality and the cost of healthcare change depending on where somebody goes, then why aren't we helping people understand how to navigate? So we put a concierge in front of accessing healthcare. When an employee or their family member calls into the advocate's looking at this data. They're going to make a recommendation on where healthcare should be accessed. If that employee goes there, they don't pay anything. It's free. No copays, no deductibles, no out of pockets. Why? Because the hospital charges $3,000 for an MRI, and that freestanding facility that's not owned by that hospital charges $450. So if $450 plus your $250 copay, right, is $650 versus $3,000, It's just economics, right? It's arithmetic. And so it really takes changing the model and becoming a consumer. Just like we've been forced to be. You're in the real estate game. When's the last time somebody just walked into, a property and says, I'll take it? They didn't do any research on it. They didn't ask you to pull comps. They didn't do any of that stuff. When you look at that, we have become a more educated consumer in everything else that we have got our hands into except healthcare. And, nearly 20% of our GDP, second or third largest expense for every employer. 67% of personal bankruptcies are because of health expenses. I mean, the reality of it is people can't afford it. Unfortunately, the model won't fix itself. And so that's what we built a model around.
Yeah, and maybe this is too deep for this conversation, but why is it? Like, why is the consumer not educated in this situation when it's, like you said, a large part of bankruptcies, a large part of the budget for companies, et cetera? How have we not reached that breaking point, I guess, if you will?
So I think that there's, what we in the business, or at least in this, I call it the salmon side of the business, right? We're all swimming upstream to try to change this. We call it healthcare's biggest lie, which our industry has done a really good job convincing people that there's nothing you can do to change the cost of healthcare. So if you've been beaten that way, thank you, sir, may I have another? Thank you, sir, may I have another? For the last 20 or 30 years, then you become conditioned to think, well, it just is what it is. And I'll tell you, man, whether we're talking about a private equity company, a CEO or CFO, otherwise very financially savvy people who negotiate down to the penny on a ream of paper, or for their telecom bill, or do all of these creative financing and moving around of everything. And in healthcare, half the time the fiscal buyer, right, the CEO, the CFO, isn't in charge or isn't really even involved in that purchasing decision. They relegate that decision to a non-P&L owner, HR, which I love HR professionals, but at the end of the day, they've got a little bit of a different story, right? If I'm HR, I'm worried about change. I'm worried about ruffling feathers. If I'm a financial steward of the organization, I got to be worried about that. So the cross section of this, which is the most amazing part of this, is that better quality healthcare is actually cheaper. So if we can fundamentally build things to do that. So why don't people know? Well, healthcare's biggest lie. So no one's been able to, tell us a different story. And when I am Dr. Jones, you've been seeing me for 10 years, 5 years, your dad saw me, whatever it is, and I am owned by that hospital, and I get paid for more revenue that walks in the door, and I funnel into that hospital. Well, when I tell you, hey, let's just walk down the hall or go get your knee surgery at that hospital or go there, you are trusting me. I'm a trusted advisor, right? I am your doctor, one of the most trusted professions out there. So again, I don't think anybody wakes up, or at least, my Pollyanna self doesn't like to think like, people wake up in the morning trying to purposefully stick it to somebody. I think that the system is just built that the wrong things are being focused on. And when you reward somebody for revenue, the answer is it's never going to come back to being and getting to the right answer. The KPIs are wrong.
Yeah. So if you're a business owner and you're listening to this podcast and you talk about what I'm assuming it seems like a misalignment of incentives, right? And you want to change it. One, because you care about your employees and you want to make sure that they have the best healthcare possible. And then two, because you want to obviously make sure that your costs are as low as can be while also taking care of your employees. What's the next step?
Yeah, so I think first it's making sure that you are a couple things. One, you gotta align your incentives, right? Your advisor needs to get paid on their performance. They need to be showing you things. So you live in Nashville, Tennessee is a very Blue Cross heavy state. So I'd imagine most of your listeners that are in your market, they in their mind think that Blue Cross is the best thing that's ever walked. Commercials on TV, the brand is such a powerful thing, but separate health care and health insurance. You don't get your health care from Blue Cross, you get your health insurance from Blue Cross. But does Dr. Jones, they just want to get paid and do a good job, but the doctors don't even like the market that they're in. They spend 3 to 9 minutes with the patient. They're having to spend all of that administrative burden capturing the dollar. I mean, like, it's a mess and it's not working for anybody. So first thing, make sure your insurance advisor is aligned and is getting compensated to achieve the results that you want he or she to achieve. That's number one. Number two, you got to step away from the traditional model. So that's funding. That is, hey, you got to change from being what we call fully insured, where you're just paying your premium and you're just taking whatever it is. There's got to be some maneuvering of the financial incentives around that. And then three, which is probably the most important, you got to have a plan designed for your employees and their families where they are rewarded for being better healthcare consumers. If you can make the decision makers of healthcare, employees and their families, have some sort of positive momentum when they become better healthcare consumers, then people shop differently, which you've seen again in every other aspect. Look at the price of TVs. Look at the price of cars. Look at how we buy a house now. We're on Zillow. We're on this. I mean, we have real estate agents. They're fighting for us. But in healthcare, when's the last time? I mean, just ask you. Think about the last time you've actually accessed healthcare. Did you ask any questions? Did you shop it at all? I mean, we're just not conditioned. So if you take those three things, your advisor must be aligned to get the results that you want them to. Your plan needs to be structured financially where you can win. And then with that alignment, the employees and their families also need to be incentivized to become better consumers. When those three things happen, magic happens. And when I tell you magic, I have clients that are paying less today in healthcare than they were paying 6 years ago.
So let's focus on that number three for a second, just because that's the one that's most fresh in my mind. And I'll use myself as an example here. We recently found out that we have a baby coming in November. And then also, I recently found out that I have sleep apnea. So we'll use those two as an example, right? I got on to my health insurance. I found doctors within the network for both examples. I found who has the best reviews. And I booked an appointment and went for it. So you're right. There was no being a better consumer, if you will, from a pricing standpoint. What does that look like in terms of shifting the decision-making process over to the employee and incentivizing them? How do we go about doing that?
Yeah, so I'll tell you how it works in a normal plan or how clunky it works, and then I'll tell you how it works, how it could work, right? In your model, hey, I looked to see who was in network. Now, I don't know what your financial responsibility is, but it's crazy if you just pick up the phone and let's go sleep apnea. There's the sleep centers that you could go to. There's hospital based, there's independently owned. I would imagine the cost difference of those is probably several thousand%. Like, and I know what you're thinking. You're like, and I'm talking in the same, 10 square miles, thousands of percentage of differences between the cost of that. So what I always tell folks is when you're shopping, number one, call ahead of time and tell them you have no insurance and that you're going to pay cash. you would be shocked to see what the pricing is. Now, think about it. Let's take ourselves back to college and Econ 101, right? You have time value of money. You've got collections risk. You have all of those things. You have administrative burden. So half the time, and not even half, a majority of the time, if you called and said you didn't have any insurance, that cash pay price would be way cheaper than it would if you told them that you have Blue Cross and Blue Shield or Aetna or Cigna or whatever it might be. So for you, you did the right thing in regards to in-network. The problem is when the person who's deciding who your in-network provider is doesn't necessarily care how much that actually cost you, then the reality of it is that perverse, incentive there. And quite honestly, reviews that we see either on Yelp or, some of these other things have nothing to do with quality. It has all to do with patient satisfaction and, oh my God, I hated their wallpaper and or they had bad bedside manner or, whatever it might be. But, at least for me, when I think of like serious stuff, I'm like, I don't care if the person has ugly wallpaper or is not great manners, bedside manners. I want the person that has the best hand and knife, right?
Mm-hmm.
Like when we get down to it. So, that perspective of it. So I would, for giggles, if you haven't done it yet, call back even the same facility, tell them a different name and tell them you have cash and watch that price. I just had vocal cord surgery. I had a polyp on my vocal cord. I negotiated my own cash pay price total. The pre-service, the anesthesia, the surgery itself, the post-op, the laser, and my travel, because I traveled to the best surgeon I could get, which was in Las Vegas. Complete all-in bundled price was $7,100. That through insurance was going to be a $35,000 transaction. So, it's crazy. Now I'm in the business, so I knew how to do that.
Yeah.
And so what do? I take my invoice and then I submit it on the back end to go against my deductible and my out of pocket, on my insurance plan. So, the interesting part on how our plans work, our plans would structure it so that there is what we call a tier 1 benefit. Whatever the employer wants as their normal plan is on. You want a $2,000 deductible, a $4,000 deductible, whatever it is. Then there's a tier 1. We call it the pathway to free. When you call in, that person's going to help you navigate the system. They're going to be able to help you ask the right questions. They're going to help you understand that where your best option might be. And in a city like Nashville, where healthcare is great, it's probably right down the street from where you maybe would have gone in the first place. If you're in more rural areas, well, maybe the best place isn't right down the street. But like when you think about those more rural areas, they're used to driving to, let's just play Tennessee. Like, if you're in between Knoxville and Nashville and maybe in a less populous city, you're used to driving over to Knoxville to go see the Vols play or used to driving into Nashville to see the Titans, right? So the reality of how we have consumer behavior in our world, pick up the phone, talk to somebody who actually knows what it is they're doing, helps you navigate the system. And that tier 1 benefit eliminates the out of pocket for somebody when they become a better consumer. And I'm talking whether it's prescription drugs, whether it's a surgery, or whether it's just a normal office visit. Because again, would you rather go see somebody that has a 23 quality score or somebody that has an 87 quality score? So even if you might say, $25 copay, who cares? It's more the quality and getting people started down that notion that says, when I'm about to access healthcare, I should probably think twice.
Yeah. So I'm assuming then with your plans, there's just a whole nother level of education that comes along. What does that look like in terms of, entering a workplace and coaching employees through that process so that, they can work together to bring those costs down while also getting, the best quality, that 87 quality score that you're talking about?
Yeah, people overcomplicate that part of the decision because number one, nobody knows what a copay, a deductible, or an out-of-pocket is right now, right? Like, so we're starting with a baseline of most people don't know what the heck their plan looks like today. So in today's world, you're trying to educate them, and then I'll ask the question: who do they call today? right? There is nobody to call. They don't call the insurance company and ask, hey, how do my plans work? And can you give me the quality scores? The insurance companies aren't built for that. So, I try to like educate employers who have, and it's a very valid conversation and concern. It's like, this sounds more complicated. I'm like, well, let's first start and say, complicated compared to what? Like, it's already super complicated in most people's eyes. And in that reality, there is nobody. So when we're sitting in front of employers and talking to them about what this strategy is going to look like, it is call the advocate, 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 call the advocate. That's it. Just call this person, whether it is Dr. Jones in the network, I need to go get a knee surgery, my mom just got diagnosed with chemo, whatever it is, the intent of this is to get somebody into the funnel the right place. And that funnel is not with the insurance company who stands to make more money when you pay more. This is the advocate company who is full of a team of nurses and doctors that are helping and designed because the normal model sucks. So that's first. And then second, it's interesting. I'll get employers like, hey, my employees aren't healthcare consumers. I'm like, no, you're right. You know what they are? Thrifty. They are sitting on the floor on Sundays cutting out 39-cent coupons to save on lima beans. And you don't think if they could save on 5, 10, 8, 9, $15,000 by giving them some sort of pathway of doing X, Y, and Z, which in our world, X, Y, and Z is just pick up the phone and call somebody. So when you think of that, outside of about 8% of healthcare, which is emergent in nature, hey, my kneecap's on the wrong side of my leg, or I'm having a heart attack. Cool. Call 911, go to the emergency room. That is less than 8% of total cost. No. The other 92% are premeditated, I probably had to take time off work. I had to call and schedule an appointment. It's all of these things, but we're so conditioned for, I need the pill, I need the access, I need this, I don't want to think about this, I'm going to walk down the hall, I'm all of this. If we just take a step back, like we did when we bought the car, like we did when we bought the flat screen TV and we shopped it and we were willing to drive over here and over here and over here, if we just take that step back. So don't overcomplicate it. People don't know what it is today. And if you give them that alignment of incentive, I'll ask you, you make more money than the average person. If you could save $8,000, would you pick up the phone and they can actually show you the quality score? Would you pick up the phone and call somebody and talk to them for 15 minutes?
No brainer.
I mean, like, I think about that every day. I'm like, luckily we have the advocate ourselves. So like, that's how I got my vocal cord surgery. I'm like, I flew to Vegas for the best. Why? Because I talk for a living. So like, the person who was going to put a laser to my vocal cords was a big deal for me. So was it convenient? No, but is anything that you're going to do the best job, the easiest way? No, I don't, it's an interesting, it's not for everybody, but you heard it here today. In 10 years, this conversation will be the norm because we're at that tipping point, right? Yeah. 20% of our GDP. I mean, like, we're at that point.
Okay. So 2 questions then from that. First, in terms of the advocate, if you flew to Vegas, right, you have out of pocket travel costs and stuff like that. Does the advocate take that into account? I guess is the first question, then we'll lead into the second question based on the answer.
The plan picks it up. So the insurance picks it up. Why? Because if I would have gone to a normal hospital in a normal scenario, I would have had a lower quality and it would have probably been 3 times, 4 times, 5 times more expensive. Wow. So my $1,200 of flight and hotel for 4 days plus the $7,100, actually $7,100 was all in. So when you think about it like that, it was really like a $5,000 surgery versus all that. So that incremental travel cost to make sure somebody gets the highest quality is a drop in the bucket.
Yeah. Okay, so then second question is, you said that, in 10 years, this conversation is going to be the norm. So outside of that, obviously, you mentioned we've hit the breaking point. What does the future of healthcare insurance look like, and how do we get to having this conversation sooner than 10 years from now?
Yeah, and it's happening. I mean, I started this business in 2018, and this conversation was like nine heads, right? Like I would get done with the meeting and people were like, yeah, you're talking voodoo stuff. And I think anecdotally over the years, people have seen different things, right? Like you intuitively know that the price you pay here, and changes. Like you know that in your head. And more people are taking on more deductibles, right? If you think about the number one strategy that has been used to lower healthcare costs, it's passing more costs to the end consumer.
Mm-hmm.
Right? As an employer, I raise the deductible from 1,000 to 2 to 2 to 3 to 3 to 4. That's just cost shifting. We did nothing to actually lower the costs and the actual mechanics of it. So I think intuitively people know it. And this conversation's starting to become more and more, I'm not going to say mainstream, but I am going to say the conversation. Like I'm on this podcast 5 years ago, I'm not on this podcast having a conversation about health insurance. And so I think you have employers that are going to demand more. You also have things in the news legislatively are happening. There's different bills that are trying to push transparency. There's different states that are pushing things. The state of Florida approved being able to get medications from Canada. And you look at things like that. And then you've got like celebrities. Mark Cuban getting into the prescription drug business is a dream for our business. It's what we've been doing for 6 years. So thank you, Cuban, for entering late. But that a guy with that kind of platform helps because now I can have a conversation that says, hey, have you seen what Mark Cuban's doing? Yeah, he's doing amazing. We've been doing that for years. That's just cost plus is just taking the fat out of the system. But when the normal health insurance companies dominate over 90% of the business, that means 90% of people are just getting screwed, not because there's anything wrong other than they're in the wrong model. They are in the model that is designed for what we call revenue extraction. That's just simple.
Yeah. Well, Lester, I never would have thought I would have had this exciting of a conversation around health insurance. But thank you for the time, and thank you to Paul Steele for making the introduction because this is great, and I really appreciate you taking the time today.
Yeah, I hope I'm going to send you a link to a teaser. I was in a documentary that's literally being released right now. I'll send you a link to a teaser that you could add to the show notes. Yeah. There were 7 of us that were subject matter experts that have come out of, let's call it the old way of doing things, and are in different parts of the business. Dr. Keith Smith, who runs Oklahoma Heart Institute, who's been putting cash pay price on the internet since the 90s. And you have different people around the business. But I think that would really personify this conversation for your listeners. And if they're interested in watching the whole thing, they can kind of follow that whole thing. But I'm super pumped and proud to be a part of that. And it's looking at the healthcare industry and the health insurance industry as a personal thing, but also it's a business. And so at the end of the day, you have to kind of understand that, follow that money. And with business comes some things that you didn't necessarily ask for.
Yeah, man, that's awesome. Please do share it because that's something outside of having this conversation I would probably watch anyway. That's right up my wheelhouse. But that also brings up a really good point. Business owners listening to this podcast, they love what they hear. What's the next route? How do they get in touch with you or take those next steps?
Yeah, I am on LinkedIn 5 times a day. It's been our number one, kind of education platform. So Lester J. Morales, CEO of Next Impact. And then my cell phone number, man, 813-784-1519. And I am so passionate about this business. That it is, again, a second or third largest expense And as a business owner, you're a business owner. Like, our number one asset is our business. So I love having conversations with other business owners, because if we can help them save 10, 15, 20% on their largest expense, that means that they're putting more, profit down to the bottom line while impacting their employees. It's the best thing that allows us to have a win-win situation with everybody involved. So it's amazing.
Yeah. Well, Lester, again, thank you. I really appreciate your passion and the impact that you're having. And I look forward to continuing this conversation.
Awesome. Thanks, man. Thanks for having me on.
Yes, sir.